Hello, my name is Stephanie Bernard and I will be presenting to you the preliminary results from our study on an in-home rehabilitation program to treat incontinence in survivors of endometrial cancer, a study led by our research team here in Quebec City, Canada. Here are the disclosures regarding funding and scholarships I have received in conducting this study. A bit of background to begin. Endometrial cancer is the fifth most incident cancer affecting women worldwide. Just here in Canada, there are over 7,000 women who get diagnosed with endometrial cancer every year. Primary treatment of this cancer is surgical, while radiation therapy is a frequently recommended adjuvant treatment. There are, however, functional consequences after these treatments. Urinary incontinence is a very prevalent one, affecting 40 to 83% of survivors. Symptoms are typically of mixed urinary incontinence and are reported to be very distressful to the survivor of. For people without a history of cancer, the first-line approach would be to recommend conservative management such as pelvic floor exercises and bladder training. Our team was interested in investigating the effects of such therapies with this population. However, a few things needed to be considered. First, survivors are very numerous, but we also know from our previous work that many of them live in remote areas. Therefore, these women have very little access to pelvic floor rehabilitation specialists. And with that in mind, and knowing that there is a growing interest in using mobile technologies to assist with the self-management of urinary incontinence, we conducted a study looking the effects of an in-home rehabilitation program that includes the use of the Elvie Trainer mobile technology to treat urinary incontinence in survivors of endometrial cancer. We hypothesized that at least half of participants would show improvement in the severity of their incontinence. As this project was very innovative, we opted for a single-case experimental design to study the effects of the program at the individual level, which would inform us on the different possible responses to the intervention by prospectively assessing repeatedly each participant. This study was replicated in 8 participants. Women were eligible if they were treated at least a year ago, but no more than 5 years ago, if they had at least 3 episodes of leakage per week. The main outcome for this study was the PAD test. Phase B was the intervention phase, where participants did pelvic floor exercises using the Elvie Trainer mobile biofeedback technology. They also received weekly telephone appointments by a physiotherapist for bladder training education and for which video support was also provided. Our participants presented with different profiles in terms of age, BMI, severity of incontinence, and also in the level of autonomy with technology. Graphical analysis is the main type of analysis recommended for single-case experimental designs. It involves comparing the results of the PAD test between each of the 3 phases. Graphical analysis can involve comparing the tendency of the values, the level of values, but also the stability of the data between the phases. Visually, we can appreciate on this graph how the PAD test data overall appears to be lower in the post-intervention phase, as well as during the intervention phase when we compare to the baseline pre-intervention phase. These results are more obvious to the individual level. So when we look at this table, we can observe that 6 participants out of 8 showed improvements in the severity of their incontinence measured by the PAD test throughout the study, with positive changes can be seen in the tendency of data, in the value or level of data, and also in the stability of the data. So only 1 participant did not show any changes from baseline, and also there was one for which changes were only observed for 1 graphical analysis. So our hypothesis was met with 87% of our sample presenting improvements in the severity of their incontinence. These findings were very innovative as they are the first to report on the use of mobile technology with this population. We will pursue with further analysis and analysis of secondary outcomes, and this study sets the basis to move this research forward into a bigger clinical trial to know if we can recommend this approach for this population. I would like to thank all of our partners in conducting this study and thank you for watching.